Anaesthesia, and hot topic of 7th National Audit Project. The latest NAP results about peri-operative cardiac arrest. This presentation is a simplified question and answer approach to the latest NAP 7 results, produced in January 2024. What is NAP, and what is the NAP 7 about?
National audit projects are reports done by Royal College of Anaesthetists, which studies rare but potentially serious complications related to anesthesia. In NAP 7, the results of which recently published, peri-operative cardiac arrest was studied between 16th June 2021 and 15th June 2022.
How many patients were enrolled in NAP 7, and what was the incidence of cardiac arrest?
Given the incidence of cardiac arrest to be about 3 in 10,000, which depends on patient and surgical factors. Finally, 881 cardiac arrests were reviewed in this audit.
What was the definition of peri-operative arrest in this study?
Peri-operative cardiac arrest was defined as 5 or more chest compressions and/or defibrillation in a patient having a procedure under the care of an anesthetist. The peri-operative period was defined as from the sign-in of the patient to 24 hours after the handover of the patient to the recovery or another clinician, for example to the ICU or the ward, or being discharged.
What is the breakdown of the cases based on the patient, surgical, and anesthesia factors?
From these 881 arrests, most of them, which was around 80%, were more than 18 years old. 70% was non-cardiac surgery and approximately 2% was obstetrics. About 1/4 of these patients couldn't survive the initial event and did not gain any systemic circulation. Usually older, male and more frail patients had higher mortality, albeit age had a bimodal pattern and neonates and over 66 were overrepresented.
Despite orthopedic surgery having the highest prevalence of cardiac arrest, it is mentioned that cardiac procedures have the highest incidence of cardiac arrest. Can you elaborate this?
The specialties in which cardiac arrest was most prevalent were orthopedic, lower gastrointestinal surgery, cardiac surgery, vascular surgery, and interventional cardiology. However, when we are talking about the incidence of the cardiac arrest in each specialty, the denominator or comparison to the total number of patients for the field indicated as activity survey denominator is needed. Cardiac procedures have the highest risk of cardiac arrest considering the activity survey denominator.
In regards to time and the type of the surgery, how is the distribution of cardiac arrest?
Although most cardiac arrests happen during the day, on weekdays and in elective cases, again, considering the proportion, the ratio is higher in emergency, after hour, weekend, and for major surgery. In comparison to regional and sedation, general anesthesia is modestly overrepresented.
What is the most common cause for cardiac arrest, and how does speciality affect the cause of arrest?
Overall, hemorrhage is the most common cause for perioperative cardiac arrest. Cause of cardiac arrest varied with surgical specialty. Sepsis in general surgery, ischemia in cardiac procedure, bleeding in vascular surgery, bradyarrhythmia in pelvic surgery, hypoxia in ear and nose surgery are major contributors.
Thank you for your attention. This presentation was based on open access articles. There is no conflict of interest, and it is only for educational purposes.